Are you itching for more knowledge? You've come to the right place. In this video, we'll be covering the topic of itching as well as obstetric cholestasis. Itching is very common. It is thought to be due to the hormones released during the pregnancy. Also, as the pregnancy progresses, the abdomen starts to stretch, and that can cause the skin to start feeling itchy. Therefore, we recommend wearing loose-fitting cotton clothes, taking cold baths, moisturizing regularly, and avoiding strong perfumes or scented soaps.
It's a formidable scent. It stings the nostrils.
If you have any personal tips or tricks to avoid the itch, comment down below. However, itching may be due to something abnormal, for example, an allergic reaction to a new washing detergent or some other chemicals. Medical diseases such as atopic eruption of pregnancy, polymorphic eruption of pregnancy, pemphigoid, or diseases that affect the liver. Many of these conditions can also present with a rash along with the itch. But one of the main causes of itching in pregnancy is obstetric cholestasis, which you may hear us abbreviate as OC. It's also commonly called intrahepatic cholestasis of pregnancy. It typically presents after 28 weeks of the pregnancy, though it may appear sooner. It often affects the palms of the hands and soles of the feet, especially at night. It is thought that OC affects around 0.1 to 2% of pregnancies, with the chance of developing the condition varying from person to person. Your genetics play a role, which means that if your sister or mother had the condition during their pregnancies, you're more likely to have it too. Asian women are likelier to have the condition compared to white Europeans, as do mothers carrying twins or triplets, those who received IVF treatment, older women, and those with a history of gallstones or hepatitis C infection. If you've had OC during your previous pregnancy, you're also likely to develop the condition again. The way we investigate for obstetric cholestasis or any other causes of itching is by doing a blood test looking at how your liver is functioning, which we call the liver function test. We look at the concentration levels of bile acids, bilirubin, and the enzymes ALT and AST. In OC, we will see a rise in the bile acid levels. The AST and ALT levels may also be elevated. In more severe cases, the bilirubin level is also increased, which can lead to people looking jaundiced.
Carotene, like jaundice, turn to yellow.
If your liver function tests are normal but you're still itching, we may offer regular blood tests on a weekly or fortnightly basis until the pregnancy completes. If the bile acid level is elevated or the liver function test is deranged, we cannot yet say that OC is the culprit, as it's a diagnosis of exclusion, which means that we will have to do further testing to investigate other causes of these abnormal findings. These causes include recent viral infections such as hepatitis B or C, an autoimmune disease like primary biliary cirrhosis, gallstones, or pregnancy-specific conditions such as HELLP syndrome or acute fatty liver of pregnancy. Therefore, we will arrange further blood tests and an ultrasound scan of the liver to exclude these conditions. So all these tests have come back negative. What's next? Although obstetric cholestasis is known for a long while, there isn't a good solution for it, but most cases will resolve soon after birth. We can offer antihistamines such as Piriton to help relieve the evening itch, as it will make you feel drowsy. We also recommend using thick moisturizing cream to help protect the skin barrier, as constant scratching can cause bleeding and scarring. The use of ursodeoxycholic acid, specifically to treat OC, has come in and out of fashion.
What makes you think I'm not interested in fashion?
So speak to your healthcare providers about it. Additionally, we may also offer an antibiotic called rifampicin if the itching remains severe. Significant liver derangement can also impact the blood's ability to clot. Therefore, we may offer vitamin K if there is concern to help limit blood loss during birth. Pregnancies complicated by OC are associated with preterm births occurring either spontaneously or are led by clinicians, which we call iatrogenic, as well as meconium-stained amniotic fluid. The main concern, however, with obstetric cholestasis is stillbirth. In the past, we used to plan for birth to take place at around 37 weeks of the pregnancy, sometimes even earlier, as we thought this was the best way for all women to avoid a stillbirth. Thankfully, new evidence has emerged recently which has changed the way we manage the timing of the birth. What this research has shown is that the rate of stillbirth is highly associated with the level of bile acids found in mom's circulation. This graph shows that most women with OC will have bile acid levels of less than 100 millimoles per litre. However, if the level is above 100, the rate of stillbirth is significantly higher. Therefore, we now recommend women to have an earlier birth, often by means of an induction from 35 weeks onwards if the bile acid levels is above 100 or is rising spectacularly. Your obstetrician and neonatal team will discuss both the benefits and risks of an early birth and agree a plan with you. For women with a lower bile acid level, we would recommend birth at around 39 to 40 weeks of the pregnancy due to the relatively higher risk of a late stillbirth, which we cannot ignore. Therefore, we will continue monitoring your liver function tests, often on a weekly or fortnightly basis, to aid with your personal management plan. In view of the increased risk of stillbirth, we recommend giving birth at a consultant-led unit with continuous monitoring of baby's heartbeat. As mentioned earlier, the itching and the condition obstetric cholestasis will resolve soon after giving birth to your child. If your blood test results were abnormal during the pregnancy, we advise repeating a blood test 6 weeks after birth. Give this video a like if you found this useful. Share this with friends and family whom you think this will help. Subscribe to the channel for more pregnancy-related information, and I'll see you again soon.